Joining us now is Joel Zinberg. Joel, did you write this paper and do the evaluation, or are you the front man for it?
Yes, I wrote the paper.
Did you? So what was your intent? What were you looking to accomplish?
Well, look, it's no mystery that the CDC failed pretty badly during COVID. All sorts of things, data failures, testing capabilities, faulty science, communication, you name it. Even their own former director, Dr. Walensky, acknowledged that. So we set out at Paragon Health Institute and the Competitive Enterprise Institute to try to figure out why. We reviewed the history, the organization, and the pandemic performance of the CDC, and we identified the source of their pandemic failures as mission creep. In other words, the CDC has grown into this large organization that has all kinds of crazy priorities that are far afield from its core mission of preventing and controlling communicable diseases. And the end result is that lack of focus left it unprepared for the pandemic and distracted it from an effective response.
It would seem to me that this is standard big bureaucracy a movement, that the mission creep you describe becomes just bloat, and at some point they lose a sense of what their mission is, and their mission gets transformed into surviving as a bureaucracy and surviving as people inside of bureaucracies. And how do they expand their power, and how do they win favor with people who have more power than them and can decide how much more they're going to get? I mean, do you find those kinds of things with CDC?
Well, that's certainly a big part of the story. That is, in any bureaucracy, the imperative is to just grow bigger. But there's an interesting part of the CDC story that is, unlike other significant agencies, Congress has never authorized the CDC. So there's no single enabling statute that defines the agency's goals, its powers, its structure. You know, it was created in 1946 as the Communicable Disease Center by executive action and in the executive branch, and that's where it's grown ever since. So Congress really has never had the opportunity to look carefully at setting up guardrails and defining the goal. And the end result is, between that and all kinds of things getting assigned to it in the executive branch and very active and aggressive CDC directors who wanted to expand its reach, you have only a tiny fraction of CDC's resources go to combating infectious diseases. One estimate that says it's not more than 8%.
And what's the rest of it for?
Oh, the rest of it is for combating chronic disease. It's for dealing with racism. It's for setting up health equity. It's for combating violence and guns. It's everything but the CDC.
Anything they need a place to put.
Well, yes and no. You know, there's an awful lot of duplication. In the paper, we painstakingly discuss where other agencies duplicate what the CDC is doing. So you have all these institutes in the National Institutes of Health, which are specifically authorized by Congress to cover areas like chronic diseases. So the CDC has a chronic disease center, and that covers cancer, it covers heart and lung disease, it covers diabetes, arthritis. Those all have institutes in the NIH, and they're much better funded in the NIH than they are in the CDC. So why do we need this duplication? And it's not just there. There are other parts of the government, too, where there's duplication. So this is why we suggest in the paper that the time has really come for Congress to do the hard work of looking at CDC, go center by center, decide what it wants to authorize, and move things that don't belong in CDC out of it. And conversely, by the way, there may be things in other agencies that do belong in CDC, and they should move them back in there.
We're talking to Joel Zinberg from the Competitive Enterprise Institute. So what exactly, in terms of you started off talking about how CDC failed us with COVID. What's your, if you were at a cocktail party and giving somebody an elevator pitch on the answer to that question, how did CDC fail us during COVID? What's the answer to that?
Well, the answer is they failed us in multiple ways. So right from the start, the CDC had a data system that they were supposed to keep state and local authorities informed of potential infectious disease threats who may be traveling into the country so that those people could be examined and, if necessary, quarantined. That system was basically non-functional, and it went offline by the middle of February 2022. And for all of February 22, the country did not have any good COVID tests because the CDC and FDA were insisting that no other test could be used other than the faulty test that the CDC had created and had sent around the country. Throughout the pandemic, you had CDC issuing guidelines that always seemed, and statements that always seemed to be several months behind the science. And that's when they were accurate at all. So you had a situation where the CDC was relying on really very poor studies. I mean, it's no accident that the sort of de facto standard for data about COVID in this country became the Johns Hopkins dashboard, which by the way, was created by a graduate student at Johns Hopkins, not by some multi-billion-dollar U.S. agency, but by a grad student at Johns Hopkins. It's why, for really good scientific information about the disease, we had to look abroad, particularly a lot of studies coming out of Israel. We weren't doing the studies, and that's an incredible failure. The CDC should have been setting up studies so that we knew who was at risk, we knew how virulent the organism was, we knew what drugs, if any, would work against it, right from the get-go, and they didn't do that.
Is there a way for an agency like that to be different? Because it sounds to me like what you're describing is the whole of the American government and the government on a state-by-state level as well.
Well, look, the CDC is unique in that, as many people have said, this was always their mission. They had waited 70 years to work in this kind of setting, and you're
talking about the COVID setting
in the COVID in a public in a pandemic situation.
An emergency. Yeah, we're under attack by a bug.
Failed. So they failed in exactly the situation they were supposed to be doing, and to give you some evidence of that, when the CDC did a study on its own called Moving Forward to look at its pandemic performance and assess it and make recommendations, they boasted that in April 2021, when Dr. Walensky came on board as the new director of the CDC, one of the first things she did was declare racism as a serious public health threat and establish processes to integrate health equity into the agency. Now, that's April 2021 was when you had a new vaccine. You were trying to convince the country to take it. Less than 1 in 5 people were vaccinated. That's what they should have been concentrating on, not these other issues. So,
but that's the politics of.
It's not an accident that the former director has acknowledged, Robert Redfield has acknowledged that the lack of focus on infectious disease was the cause of the poor pandemic outbreak.
It's interesting, Joel, how you describe them as the department in waiting. That their dream had always been to get into that moment where they were in the driver's seat to fight off an invading pandemic. And that seems to me the worst possible situation for a big bureaucracy to be sitting around waiting for its mission, its number one mission to actually be enacted, because I don't think we do very well when an organization is not being tested in a marketplace and being forced to deliver the goods so that it can be updating itself, kind of like the military had to do when they got into Iraq and they started going through one leader after another, and in Afghanistan, and the bureaucracy there is so big it can't really adjust, and it takes decades to change what should change in a few months. Again, I feel kind of hopeless about it, but do you have some sense of that there being the potential to make CDC worth having?
Well, I think there's certainly the potential. The danger, unfortunately, is that the CDC, like most bureaucracies, as part of that Moving Forward report I mentioned a few minutes ago, its imperatives are to just get bigger, and they're saying the problem is they didn't have enough funding. And, their allies in the public health bureaucracy are saying the same thing. We have to increase their funding. That's what we should do.
The failures of government are always because there wasn't enough. We're talking to Joel Zinberg, who is with the Competitive Enterprise Institute, talking about the failures of the CDC. You mentioned that the statements about racism being a public health crisis and how that showed a lack of focus, but that suggests probably the White House, yet a new White House in spring of 2021, and the Biden administration wanting to heighten the race divide and exacerbate all those nerves. So they probably got some signal from the White House that they should make a declaration like that. And that's the politics,
yeah,
isn't
there's
it?
very little question that the agency during the pandemic was susceptible to political influence, and unfortunately that influenced some of their scientific pronouncements. So, we now have evidence that Dr. Walensky was talking to the head of the teachers union when they were going to issue new guidelines on school reopening, and that the language they ultimately promulgated was drawn directly from the teachers union. So, that really is disturbing that a scientific agency was relying on a non-scientific organization that obviously had a conflict of interest and just coincidentally happens to be a big donor to one political party.
But wouldn't she say that, well, covering the political part of it is part of my responsibility as well. So as we're looking to make pronouncements, I have to talk to the head of the biggest union in the country, the biggest teachers.
Well, actually, the one thing, I think one very important message we have to take away from the pandemic is that we can't turn over public policy decisions to public health people and public health experts, because there are many things to consider. So a study that, I did with my, I'm also at the Paragon Health Institute, where I'm head of the Public Health and American Wellbeing Initiative, and we did a study talking about the lockdown measures that were imposed during the pandemic, and we found that the severity of a state's lockdown measures had basically no significant connection with their health outcomes. But of course, they had very strong impact on the state's economic outcomes and educational outcomes. And the take-home message there is that if you listen only to the public health people, they're not thinking about the educational outcomes or the economic outcomes. For them, their vision is health always. But it's public policymakers have to take all of those things into account, and they can't turn everything over to the public health people. So the CDC is supposed to be providing the president and the public policy advisors
with guidance,
the best health and science information.
Yes. They're
not supposed to be considering what the teachers union thinks.
Yeah, so that whole thing about trust the science was a bogus concept. We're supposed to have political leaders who know how to take information from all different sources and view all those problems in one big pot and figure out how to make the stew taste best. And they didn't do that. And this is inherent in that kind of contest, isn't it? When you've got an invading problem coming in the form of a bug that's going to infect, and they're scared. The politicians don't know what to do, and the politicians bail on making the decisions. So they say we've got to trust the science. They say we've got to listen to the CDC, and they authorize things that work for them politically at the same time as merging in a little science, and it becomes a mess.
Well, look, thankfully not every politician did that. I mean, initially everyone had no information. They imposed lockdowns. But many states like Florida, like Texas, they began to relax those lockdown measures pretty quickly. And things opened up there. Kids went back to school. There are other states, fortunately, that, listened. They were perhaps even more extreme than the CDC in keeping schools closed and maintaining lockdown measures. Places like California. So, that's one of the things we compared in that paper.
Okay.
And it's the severity, California was one of the most extreme states in its lockdown, and Florida was one of the least extreme. And the results speak for themselves. Florida did much better economically, and our kids staying in school and their educational outcomes than a place like California. And by the way, that was reflected in the people voting with their feet. People began leaving California in greater numbers than they had in pre-pandemic years during the pandemic, we think in reaction to those severe lockdown measures, and they began to go to places like Florida and Texas.
Joel Zinberg, anything else you want us to know?
I want you to let your Congress people know that this is an important reform effort, that they have to contact them and get them to authorize the CDC and get them to refocus on their core mission, which is combating communicable diseases.
Joel Zinberg, Competitive Enterprise Institute. Good to talk with you. Thanks for taking the time.
My pleasure.